Welcome back again. So today, what organs are necessary in making qi? Again, seems very easy, but I'll tell you how this comes into clinical and case study usage, exam usage even. So let's go through, I call it the qi man and how qi is made, and then we'll get the organs from there. So in order to make qi in the body, of course you need to have air qi, kong qi, so breathing. You need to have gu qi or food qi. Okay, you need that to go into the stomach. You need the spleen qi to be strong, to come up and grab that. And of course, remember the function of qi? Transform that into something usable. And then ascend it up to create zang qi in the chest. And then your yuan qi, kidney qi, comes up and it meets and it makes deng qi. From there, it splits off into wei qi and to ying qi. And any extra of ying qi goes back to the kidneys to nourish them. Okay, that was a lot of qi, 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 but which organs were involved there? Well, we had the kong qi, so lung. We had the spleen qi, so spleen, and stomach you can include in there as well. And we also have the kidney qi. So lung, spleen, stomach, and kidney. And of course, the heart helps with pushing the qi through the body as well. The reason this is important is this. If someone is very qi deficient, have you ever noticed in a lot of textbooks, just general qi deficiency, you see a bunch of source points. And what are the source points of? Or you see backshew points. And what are they of? You oftentimes see lung 9, kidney 3, spleen 3, stomach 36. Very common. And now can you see why? The reason for that, right, is those are the guys that really actually make qi at a level. The lung absorbs and helps make qi from the air. And then the spleen helps make qi from the food that comes in along with the stomach. And then the kidney adds a little bit of pre-heaven energy to it to help create the final aspect of qi that goes and flows through the body and up to the wei qi. So choosing your points is very easy in terms of looking at qi deficiency issues when you understand what makes qi in the first place. So an example, patient comes in and they just feel, now remember we talked about earlier, couple lessons ago, qi deficiency, patient feels fatigued, they feel slightly cool, they have a little bit of frequent urination, and it's clear. They feel a little bit low in energy, poor digestion. Okay, so you think, okay, they seem to have a bit of a general qi deficiency. I want to tonify them. Well, I can use some general qi tonifying points. I can use lung 9, spleen 3, stomach 36, kidney 3, or I can use bladder 13, bladder 20, 21, bladder 23, and all those will be like a general qi treatment. And in fact, if you're a new practitioner, these are great things to do while you try and figure out what the heck is going on with your patient for the rest of the week while you research. So you see them, you go, okay, I know this is qi deficiency. I'm going to give them a nice source point or backshew treatment with all the organs that tonify qi because their pulse is weak, their tongue is pale, scallops, all this kind of thing. Go, okay, great. There's a nice first treatment just to stimulate the organs that make qi in the first place. Okay, so that's why it's important to know the functions of qi. Let's also look at it clinically like this. If someone has very poor air quality around them, like parts of China right now, like in Taiwan, when the lung is breathing in poor air, then it cannot make proper qi. So it's important because in your clinic or on a case, what becomes good advice is to say, okay, you need to do something about your air quality because no matter what I do with needles, if you still are going out there and breathing poor air, you cannot make proper energy in your body because we know that one of the cogs in the wheel is off. Maybe they've got a poor diet. Well, how is the spleen and stomach qi supposed to be strong with a poor diet? It can't extract good nutrients. And then after a while, and then it becomes weak, it can't transform nutrients. And then they really can't eat anything. We see this all the time in clinic. So then you have to say, okay, your qi is low, so we need to work on your diet because one of the cogs in the wheel is not working, right? Or if they came in with poor essence, poor genetics is similar, then you have to say you have to be very careful with good air, good clean air, and good healthy food, and nice strong emotions because that aspect of you is just lower. Or maybe they overwork a lot and their kidney energy is becoming very low. Well, all the acupuncture in the world's not going to do anything if they keep working just as much. It will help a bit, but nothing really substantial. So look at it that way too with your when you're with your patient. If they are doing something that affects one of those qis, like kidney, lung, or spleen or stomach, then you have to discuss lifestyle with them. Really great for your exam as well. Okay, now tomorrow we have a case, and we're talking 8 principle tomorrow. But we have a case. Yay! We all love cases because we're all a bunch of case addicts. I get it. I will see you then.